Good morning and welcome to the WellMed Charitable Foundation Caregiver Teleconnection. Today we have a presentation with a guest speaker and I'll tell you about her in a minute. But first I want to introduce our dear Lucy. Lucy Barylak has a master's degree in social work from McGill University. She is presently working as a consultant for a health network in Montreal, Canada. She's been involved in various research projects and has published numerous articles related to caregiving issues. Also, she's lectured at several universities and colleges on innovative approaches to caregiving and presents annually at international and national conferences. Lucy is also a consultant for private industry in the United States, including her work with WellMed Charitable Foundation and their clinics in Texas. In addition, Lucy would like you to know that she was a caregiver for her own mom for about 10 years. Now, our guest speaker is Dr. Pam Orzeck. She has extensive experience in clinical and community practice, having worked as a frontline social worker and research practitioner for 25 years prior to joining the faculty at McGill. Pam is currently the Director of Field Education at McGill School of Social Work and leads a team dedicated to ensuring a positive and meaningful field education experience for social work students. And if any of you are social workers, you know how important that is. Pam's doctoral research focused on women's bereavement experiences after caregiving, and she is currently the co-principal investigator on a national grant related to caregiving, bereavement, training, and support. And with that, Lucy?
Well, thank you so much, Evelyn. And once again, Pam, thank you so much. We're really looking forward to this. Now, I do want to say that we're going to give you as much opportunity to ask questions as we go along, and don't hesitate. So with that, Pam, you're on.
Okay. Thank you, Lucy. Thank you, Evelyn. Thank you, Minerva. I'm so happy to see all of you. And I'm happy to see those who are repeat visitors from last week and all the new visitors as well. I'm going to share my screen so that we can begin. So this is part 2 of, everyone sees my screen?
Yes.
Okay, perfect. This is part 2 of our Life After Caregiving. And really it's focused on what are the emotional difficulties that caregivers face after a loved one has passed away, a topic that's very sensitive and sometimes hard to discuss, but really important to talk about. And as Evelyn said, there's not that much research out there. So it's very important that we, on behalf of caregivers, that we have these conversations and that we discuss these important issues. So today I'm going to do a tiny little refresher about what happens during caregiving, and then what happens when it's over, and how do you go on, and what is needed to go on. That's just my plan. But please feel free to ask questions in the chat or put your hand up. We're happy to make this as engaging and interactive as possible. And I cannot see the chat or anyone, so if there's questions, please stop me, Evelyn.
Okay.
Okay, so what we talked about last time was that becoming a caregiver is an evolution of a role that already existed. So a parent, a child, a partner, or a friend, which was some kind of reciprocal assistance or help, occasional. But then when an event happened that could have been anything from a illness, an accident, any kind of diagnosis, there's a certain point in time where the caregiving becomes more intense, more frequent, and more involved. And that's where the roles of parent, child, partner, friend, etc. can be added on, and caregiver becomes an add-on. And I'm sure this resonates with many people because talking with many caregivers, they all could identify the point at which things changed in their relationships.
Pam, I'm really sorry to stop you.
It's okay.
Your screen is so big. Uh-oh, now I've lost it. That I can't get my little control line down at the bottom.
How is it now?
Same.
Really?
Oh, one more
What about now?
problem.
It seems okay on my screen.
Does it? It's just me today, huh? All right, then you're gonna have to do chats, but Minerva, I guess you're gonna have to let people in because I don't have that bottom, row for Zoom. I'm sorry.
That's okay. Lucy, it looks okay to you?
Yes.
Okay. Okay. So what we talked about when we talk about what we talked about last time is that the caregiving journey has no roadmap, and most will enter with some trepidation and lots of emotions and recognition that their lives will change and that some strengths and vulnerabilities will need to be called up, and that things will change, that it really is connected to loss, and there's a lot of work to be done with caregivers on experiencing that loss, and that illness does change the nature and the quality of the relationship. But it's important to work with caregivers and to understand that the transitions involved in caregiving can be discussed, can be talked about, and can be worked through together, recognizing that there will be change. So just that knowledge that things will change and there will be transitions and that loss is part of the role, that's a conversation that's important to have with caregivers. So what happens when the care receiver passes away? Well, last week we talked a little bit about this. Typical reactions of caregivers are actually relief and depletion. It's actually a combination of the two. There's a sense of relief because it may have been a very stressful, difficult time, which could have lasted for 6 to 8 to 10 years. Relief because the person that you might have been taking care of was suffering or having a hard time. Relief because the burden that was intense might be done. But there's also the point of depletion. And by depletion, I mean complete exhaustion and inability to sort of have the energy to find themselves in a new kind of way. So when I first started my research, it seemed very clear that it would be relief or depletion, and every caregiver I interviewed had relief and depletion. It was a real interesting dyad. So it made me think that just like caregiving, the post-caregiving, the period after is full of complicated and complex emotions. So what I noticed was that the caregiving became a core identity for caregivers, often taking over other identities, which included worker, volunteer, grandparent, parent, etc. So that it took over so much that afterwards it was very difficult to find new identities, to recover lost identities. And it took people the caregivers I researched, it was all up to 3 years until they found their way. So it's important that we know that the needs of caregivers do not end with the care receiver, with the loss of the care receiver, and that there are multiple things to look for in caregivers, helping them through the period of post-caregiving. Okay, so here's the tool I referenced last time. This is called a careography. So this was part of my research where I looked at what are the significant events in the care receiver's life that impacted the caregiver. And an example of this could have been if the care receiver had a fall and went into the hospital, that could have been the time when the caregiver said, you know what, I have to give up my work, or I have to stop doing certain things. And when you look at it with the caregiver in retrospect, it's very cathartic and helpful to see what events happened and simultaneously. And Lucy couldn't see it when I showed it. I hope you could see it now better. But this is one example of someone I interviewed in my research. And you see when, let's say Alice is the fictional caregiver, you see when Alice's husband got diagnosed with Parkinson's and then had limited ability and then had to be placed in a long-term care setting and then died in the hospital. All of the things below were how she decided how her life was implicated and impacted. So she stopped participating in social activities. She felt guilty about him being in a placement, so she ended up going to visit him 12 hours a day. She spent a lot of time, she was quite exhausted. And then after her husband died, she realized that she had some physical health issues. And so I followed Alice for 2 years after her husband's death, and she had a lot of physical issues to manage. And she felt a lot of sadness and guilt and relief and depletion. But after 2 years and some intense counseling and physical checkups, Alice was able to find some things in her life that gave her meaning, and find some things that gave her joy. And this is, yep, go ahead, Evelyn.
Was she angry
Alice
that she had all these sick things that she'd never taken care of?
She was very angry, but she agreed that by giving herself wholly, she gave her husband everything she had. She had no guilt about her involvement. But afterwards, when she was so sick, she said, I wish I would have taken care of my health too. I gave so much, but I really wish I would have looked out for myself too. And Alice had, I think, 3 sons, and they were they even called me many times. They were constantly telling her to go to the doctor, to figure out why she was short of breath, to follow up her own health, and she never did. So she did have some regret on that front, that she didn't listen to her kids and follow it up.
What I found really interesting is that once she placed her husband, you said that she was feeling so guilty that she went and spent 12 hours a day at the residence. And, and that's very typical of a lot of caregivers, that it finally, they can't handle it anymore, or the care receiver needs a lot more care than they can provide. Yet that guilt sets in, and instead of moving on with their lives, they spend most of their days at the residence. And that has an impact, because it's very much what you're saying. If you don't develop your life, or you give up everything in your life for that person, how are you going to deal with that once that person is no longer there? Where will you put those 12 hours that you spend and taking care of that? So is it okay, Pam, if maybe we could kind of open a little bit the discussion, Evelyn?
Sure.
Can you see anything? Or
Yes, I fixed it. I had it on full screen. It was my problem again.
Okay, Evelyn, you at least. Could somebody share with us whether you're a caregiver now or still a caregiver, or if you're the person you're caring for has passed, or even for anyone who's in the healthcare system? Have you noticed things like that?
All you need to do, folks, is press *6 if you're on the phone, or unmute yourself. I have a little website that I think is working. Yes, and I can see who would like to talk to us. Myra, good morning. Hello again.
Good morning. I can definitely relate, and I think Pam captured the information perfectly. I'm currently a caregiver for my mother. It's been 4 years. It's impacted me in so many ways. I lost my job in July, trying to figure out what to do because she lives with me. My mother has cancer and Alzheimer's. It's only me. There's no other siblings or family members or anyone to help. Got her into an adult daycare center, but she has like 5 doctors that need to be managed. So what happens is you begin to self-isolate, and then you do stop not doing things. You can't get together with friends, your hobbies, your life, everything gets put on hold. Last year I went on a vacation that I had signed up for, thinking that things would be different, and things had gotten worse. And I couldn't enjoy it, guys. It was so much work in trying to prepare to go that I was exhausted when I got there. And then I was constantly with the cameras and paid someone to stay with her, that I decided that because I am all alone, that I am going to put those things on hold. And I got to say, my mother's medical is so nicely attended to, and I squeeze in my own doctor's appointments, and I don't have any health situations, thank God. But I am nervous because the gym got put on hold. Eating poorly is taking place. There's a lot of stress. I'm exhausted. So I am worried of what's it doing to my health. And it's easier said than done to take care of yourself, because it's not only the physical exhaustion, but it's also the emotional. And then if you try to get some help, then you have to manage that help. And then that creates sometimes some exhaustion. So I agree, but it's a journey that I've accepted. I'm trying to do some spiritual. I listen to motivational speakers. I'm trying to say, well, if you're confined at home, taking care of her, organize your place. So I'm trying to find some positivity, but I don't know when the journey will end and what will be left of me.
Thank you, Myra, for sharing that and being so open and so honest, But what I would like to say to you, Myra, is that you have so much insight into yourself and what you're going through. Please keep that in mind. And you said you don't know when that journey will end. So as you go through this journey, build in the things that will allow you to take care of yourself, whatever it is, little tiny things, so that when the journey does end, you're not left, oh my God, now what? What am I going to do? I've isolated myself. So it could be as simple as not isolating yourself or going for a walk once a day. Well, what do you think, Pam?
Yeah, I think that, I really thank you, Myra, for your candor. I think that I agree with Lucy. Your insight into it will actually probably help you a lot. Recognizing that the identity of caregiving eats into other identities, and that caregiving is indeed a full-time job, full-time plus. And it sounds like you're the general contractor for this job. You're coordinating everything. So, and it's all on you. So I think whatever you can do to give yourself protective factors, and there's a slide at the end that talks about the 5 protective factors, and I can't emphasize them enough, but they are rest and self-compassion and connection to others, really important, and meaning and purpose. So those are the things. So your purpose and your meaning, being the sole caregiver to your mom, it's a very important role, but you also have to find time to connect with others and rest, which means sleeping and eating properly. And I know that that's easy to say, 100%, even exercise. A doctor once said to a client in front of me, said 30 minutes of a walk every single day is better than any antidepressant anybody could be on. So 30 minutes of a walk, which for some, it seems an impossible task to actually get out and walk for 30 minutes, but that could be a very small goal for each of us every day. And that really has a big impact on our health, on our mental health.
And there are resources. We need to work as hard as we can to, when you want connectedness, is to use those community resources, the SOS caregiver program or the caregiver programs at every area agency on aging. They have a little bit of money for respite care, maybe enough to pay for 30 minutes a day for walking. Or maybe your neighbor, or maybe your best friend that you have lost contact with. There are so many caregivers now. 1 in 5 people adults are caregivers in the US. Have them help you.
There was
Absolutely. Thank you so much. And I am, by the way, looking at things like that and trying to see what things I can even do at home, or hobbies, or trying to pursue something of what my life was, to keep one foot. And I've been telling this to other caregivers, let's try to keep one foot on the other side of the fence. Something that's a string. Let's not completely go dark, because hopefully the journey at some point will end. And I also see those caregivers, and I don't want to be one of those individuals, and it hurts. They stay stuck where they are and they can't get out. They can't get out of where they were. They've lost everything. And I don't want to wind up that way. And I try to help other caregivers not think that way, because I don't want to see them in that state either.
Well, thank you for that. There was someone was asking about something about isolation. Did you see that? Could you put that back on again? Because I think it was a very important question.
It's in the chat. It says, Deborah says, what are some ways to be less isolated during this?
Could you want to respond to that, Pam?
Well, I think it adds on to the thread that what we were just saying and what Evelyn is suggesting, and Myra, reach out, push yourself to reach out to people in your circle or in your neighborhood, or even, put up a thing at the pharmacy or the grocery store. Anybody want to walk for 30 minutes a day? Anyone want to, I don't know about this concept, but I think there are meetups, which is a concept where people who are like-minded can do activities together, even people who live in the same town. Or I think it's important to reach out, which might be hard for sure. And I'm sure there are Facebook groups of caregivers and even the AAA groups like that Evelyn mentioned, where there are people who could offer that kind of outreach. And I texted Lucy this week that I saw on the Rosalind Carter Institute Instagram, they posted a text phone line for caregivers. That was a confidential service. I can try and send it to you, Evelyn, as well.
That'd be
But
great.
it looked like a great resource.
And Alzheimer's.org has a chat room where caregivers can go in and, talk about what their issues are and get feedback from other caregivers. And we'll get that resource, when we send out resources.
Thank you. Okay.
One comment I would like to make. You said that you have her in a daycare. So what do you do with your time when she's in the daycare?
So what I do is, my mom has 5 doctors. So for example, today when she left in adult daycare, I started looking at the calendar and her medicines to make sure that I am full with everything. And I am now have this session. I have another session coming an hour. For me, knowledge is very important. So I get as much information as I can and I try to prepare. She'll be coming back around 2:30. I filled up all her vitamin, the pill boxes. So it's amazing because I'm very organized, but I'm constantly doing things. And then I'm constantly rearranging my home and trying to organize things, because I know at some point my living room might become her bedroom, because the bedroom right now is currently upstairs. So when she's, she just started going the end of October, and she really has no clue where she's going or how she gets there, but it's a kind of place that they can manage her. So because she lives with me 24/7, imagine anything that I'm doing. Like, I even went to the library this morning to print documents of things I have to fill out for her medically. But now I can do those things, go to the grocery store, put gas, not worried about my mother. So that's what I do. That's what I utilize my time for. I wish I could eventually, maybe when things settle down, I could look into maybe going back to the gym while she's at the adult daycare. But remember, with Alzheimer's, you don't know what's going to happen next week or next month. Are we going to have an emergency hospital stay? So I try to really utilize my time, but I don't sit here wallowing. I cry, I feel bad, but I try to, and some days you just don't have the energy to do anything. I let myself go, but then I pick up again and then I start going. I belong to actually several support groups as well, because I learn and I also give back to my community, because this is difficult to go through.
Thank
Kathy, Lucy would like to talk to us. Sorry.
No. I was just thanking you for giving back to your community.
One thing that my husband passed away in April. He had Alzheimer's for over 10 years, and I cared for him half of that time at home and half he was in a facility. But one thing that I found that caused me far less stress is that I had all the business in order. Everything that had to do with any of his insurance or deferred comp or anything, the financial area, I had that all in order. And when he passed away, you have a lot that's coming at you.
Mm-hmm.
And you have to be prepared, excuse me, for all of that when it comes. And I then decided, there had to be one folder that everything went into, and I'm so glad I did that as well. But the other thing I think that's important when it's couples and it's something like Alzheimer's or anything, the other spouse that doesn't have Alzheimer's could pass away first.
Yes.
So you have to get both of the
Yes.
individuals' business in order. And I have 2 daughters that I trust with my life, so I'm very happy with that. And I give them full reign on everything that happens with me and our financials and everything. So not everybody is that fortunate. But I think that's very, very important. Something that causes far less stress along the way.
It's thank you for that. That's really a very important piece. But what you said, and maybe Pam will agree with me, from the research that I've done throughout the years, many times caregivers pass away before their care receiver. It's a known fact. And this is why it's so important to listen and to see that, to have the tips and the ways to know to take care of yourself. And if you look it up, you'll see, even on Google, you'll see there's a lot of very important research, qualified research that tells us exactly that. So Pam, I'm just, kind of passing it on to you in the sense of where do we go from here?
Okay, so I'll just spring off what you just said, because I think a lot of what we have learned in the last, certainly within the pandemic, but in the last decade, is that stress management is very important for our health and well-being, and that those caregivers who do die first, the mortality rate is high. That's obviously a crisis for the family, since the caregiver was taking care of the care receiver. That's a huge crisis. But how can we manage our stress in a way so that our everyday lives aren't as overwhelming? And so Sandra had mentioned support groups, caregiver support groups, and even walking in small bursts of 10 minutes throughout the day. And even, there's more and more talk about meditation and mindfulness and having quiet time in the day to settle your mind. And I really enjoyed a webinar. I really enjoy the use of apps called Headspace or Calm that give you free content about just relaxing your mind and finding some peace before your day begins, maybe early in the morning, if that's how it works. And there's a man named Dan Harris who used to be on CBS and has a really great, I think it's a TED Talk or a podcast called 10% Happier. And it's called 10% Happier, and then it's called A Skeptic's Guide to Meditation, or A Fidgety Skeptic's Guide to Meditation and Mindfulness. It's really interesting, and it's almost like it's an everyday version of how you could approach mindfulness and meditation. So it's really, I find it very palatable in small pieces. It's not a large investment in time, but it might be really interesting. All right, I'll go back to my screen. Whoops. So I don't want to negate the fact that after the loss, there are positive emotions. Some people feel relief and pride and peace and gratitude and appreciation and generosity, and the fact that was a reciprocal relationship and they gave back, and that it gave them meaning and purpose, and that they had the courage to do it, and it gave them a lot of personal satisfaction. So I don't want to miss that part. But after loss, people think, oh, well, it's been 6 months, 8 months, a year. I'm sure you're over it now. I'm sure you've gone beyond it. There's all this societal pressure to move on. And that's why I love this slide, because there's this expectation that our Kubler-Ross, our stages of grief are just this beautiful linear line going forward in the future, when in fact it is a complete mess of back and forth emotions and feelings that come up at the sense of a smell of something, or a room, or a visual, or any kind of memory could bring you right back to the beginning of the loss and the pain. So it's just important to realize this is not a linear process, no matter what anyone says, and that if you're in grief and loss, when you move through it, it could take many years. Don't feel pressure to be done. Don't feel that you're sick or abnormal for the process. You just go with where you're at. And that's really important. A lot of caregivers said to me, I feel like I should be beyond this already. Or my sister-in-law, my brother-in-law, everyone said I should just get back to life and all this judgment. So we should just be kind and self-compassionate that this is a process. And this is my favorite slide. It's such a good one to show how the ups and downs and how to get back to a normal, to get from normal functioning back to, you see how it doesn't say return to normal again? You start at normal, it returned to a meaningful existence. It doesn't take you back. Even the visuals are different. This is like red squares. These are red circles. It is a new definition of who you are post-loss, post-caregiving, and that there's all these elements that come and go during the process. And this process could take any amount of time. And at a point of 3, 2.5, 3 years, 3.5 years, 4 years, there's an element of where people feel stuck. They can't get out of where they were, or they're just stuck in the past. And there's a lot of work to be done as healthcare workers to discuss finding new purpose, finding new identities, finding new abilities to move on. And this is a lot of work. But the first step is recognizing that it is a messy tape and a messy journey. And if we recognize that caregiving has losses, then we know that grief will also have losses throughout. And a lot of my research showed 3 main themes. One of them was that the losses are compounded, which is good for finances, but not good for losses. So compounded losses mean if you have compounded finances, then it's growing and growing each year, one thing on top of the other. Compounded losses mean that every loss, every micro loss even becomes a bigger one as it snowballs. And a loss could be as simple as, we don't eat in the same way anymore. We don't sit together and talk in the same way anymore. But so by the time the loss happens, the great loss of death, you've been going through multiple losses and compounded losses, and that makes it harder for you to manage. So it's just a recognition of that. It's really important because in society, there's a big judgment and emphasis on just like, it happened, now you move on. So we have to push back against that. And then we have to also check in with ourselves. And this could be the role of the healthcare worker too, checking in with people. How are you doing? How's your everyday life back together? What do you do all day? And people should follow up with their emotional and physical state. So they could seek therapy to work to talk about the loss. They could seek family physician to check up on their health that they may have neglected, like our dear Alice. And a lot of the check-ins is also to talk about any kind of guilt, to work through it and to talk about any of the guilt that happened and to talk about the stages of grief and to really look at how the caregiving affected your identity. Because if you see how it affected your identity, which is our careography, to look at it, it will help you decide if you want to go back to some old identities and interests or create some new ones. So it's really a combination of the two. And why does it matter what happened before? How is it, why does it matter? Well, it'll help your next steps. It can help you access the emotional support you need by looking back and finding the good stuff. You'll follow up with your physician, and then you need to look at it's important to look at wholeness, which is a brand new concept in the literature, that it's not just about wellness, it's about feeling whole. And that means different things to different people. That could mean a gratitude and the ability to look at things in a different way. It also could mean knowing that you did a beautiful job in your role as a caregiver. That could make you feel whole. And finding new interests and meeting new people also. And then, as I said, the protective factors that help: rest, self-compassion, connection, meaning and purpose. That purpose should have a capital P. That's my mistake. And that there's no shame in feeling depressed or upset or feeling that you need help to get out of bed sometimes. I had caregivers who said to me, I cannot get out of bed. I have nothing to live for anymore.
I just
And-
want to make a
Hold
point.
on, let me just go to the next one. And the next slide is just any questions. Does this resonate? Let's open it up and have a conversation. That's my slides are done.
Thank you.
Lucy?
Yes, I just want to point out the difference between with depression, let's talk a little bit about that. You know, there are situational depressions where something has happened, you're feeling bad, you're having a hard time, you're crying, but yet you're able to get up in the morning, take your shower, eat your breakfast, go to work, go for a walk, okay? Clinical depression is when you're really cannot get out of bed and you cannot function. So I want people to be very aware of that. If it's a situational and, you know, and it's normal, as Pam was saying, all those feelings that we're going through, and sometimes it takes years, but be very wary that if you can get out of that depression, you owe it to yourself to go to the doctor, okay, to get a good checkup. And if you need to see someone else for medication, that's your responsibility. It's really important to keep that in mind. The other thing that you were touching on guilt. I want to share, I did a little bit of pro bono work during the pandemic. And I had a client, a man who was in his early 80s. His wife developed COVID, landed up in hospital and passed away. And he was not even able to go and say goodbye. This man's guilt was so overwhelming to the point where he couldn't function. He felt so guilty. A lot of us, listen, when my mother passed away, there were guilt feelings that I had as well. Could I have done better? Maybe I didn't see her enough as I should have because I set limits for my own preservation. At the time, my children were still at home working full time. So don't be so hard on yourselves, okay? About anything. And most things, most relationships or things that don't work, we just hammer at ourselves. So I want to leave you with that. And it took a long time. And this gentleman, he, you know, periodically he'll still call and I'll reinforce to him and tell him that he did the best that he can. It wasn't his fault at that point. So I just wanted to share that and just wondering if other people. The other thing also, just to throw one more thing into the pot, the whole idea of acceptance, okay? When you're a caregiver, it's important to accept where your care receiver is at and develop a new relationship sometimes because a person is no longer who they were before. But the other thing is the acceptance of, I am now a single person, or my mother has passed away. My father is no longer here. My partner is no longer here. It's not an easy road to go through. And if you need help with that, don't hesitate to get it.
Yeah, and there are, I'm just putting one in the chat now. There are really amazing resources for grief and bereavement. The Australian Centre for Grief and Bereavement is an amazing resource. The Canadian Hospice Palliative Care is an amazing resource. Just because it's across the border doesn't matter. Pallium, also there's a, there's a few resources that, mygrief.ca. Anyone can access these things, even if it's in Canada. There's a lot of resources that can be found. And in fact, we're building a Canadian clearinghouse of all grief and bereavement resources. It's going to be open access to everybody. We're going to have webinars and podcasts. It's going to be a really big thing. We got a big grant from a private foundation because there's a lack of state of like, I guess the word is a clearinghouse, but because of that, we're going to bring it all together, even if it means other people's links, like we'll link to the WellMed Charitable Foundation and all the great work they're doing. So there are resources out there, but it does take digging. And I can send Evelyn and Lucy as much as I have on grief and bereavement, and people can look through those resources because it does exist.
And I will get all of those out with the post-session questionnaire. And I found an interesting one. It's which you'll get. It's for online Zoom calls, and it's actually sponsored by Psychology Today, but it's with a private agency, Moon Township, I think, in Pennsylvania. But it's open to anybody who signs up for the Zoom call, and it is about life after caregiving. And there's also the eldernetwork.org has something called When Caregiving Ends. And those are the only two resources that I found in trying to research. I did find one book on Amazon. It was called After Caregiving Ends, A Guide to Beginning Again by Denise Brown. And I'll send that one out too. And caregiver.org has a tip sheet. That's all that they offer for life after caregiving.
So I'll send you a few resources, Evelyn, so you have.
Thank you. And I'll get
Mostly websites where people can look at trainings and webinars and conversations. And
Great.
Lucy and I are going to write a book very soon.
Yay!
We're going to write a guide.
Guide.
We're going to look at writing a guide, and when we do that, and if we do that, we're going to talk to caregivers. We're going to want your opinion of what you believe needs to go into this guide.
Very, very cool. We'll
And
have
I think
Sid-
what's really important is that in a society where we don't talk about death that much,
Mhm.
and in a society where there's a lot of burden put on caregivers without that much support, those two together create the need to have these conversations, open them up, and have more of a dialogue and about, more of an understanding about what caregivers need in post-caregiving in their bereavement. So just as an example, we're creating a telephone outreach support program to follow up caregivers after the loss, because so many people feel isolated. So we have a protocol that could be, transferable to others, where in any agency, which could be an AAA, there's a students who are assigned to doing the follow-up and trained on counseling and trained in bereavement follow-up. They'll call caregivers and say, how are you doing? Do you want to meet for coffee? I'm going to call you every week for the next 6 months. Is that okay? And that connection, just like Deborah was saying, like the isolation is huge. So breaking that connection, bridging that connection and breaking that isolation is really important.
I saw that there were some comments written also. Is there something that we should all be aware of?
Do you want to address the chats, Pam?
Sure. Let me look at it. So Deborah is saying that she does need some kind of help in terms of reaching out to others and getting some counseling. So Deborah, I'm not the expert in terms of the state in which people live and what connection, but I imagine the area, is that true? The aging, what's it called?
Area Agency on Aging. And they cover the country. There's 655 of them, and they cover the country, and they all have a little bit of money for, caregiver specialists, caregiver supports. Many of them also run support groups, or can refer you to a support group. So it's important. And I'm going to send out the Elder Care Locator phone number, which with your zip code, you can find all of the resources in your community. You can also call 211 and ask for your area agency on aging.
Yeah, and thank you for Evelyn. And I think that Tom put a good comment in there. If someone says to you, call me if you want to talk, you're not going to call them. You're not going to necessarily be outreaching to get them to give you time for you to talk about your loved one. If you know someone in a situation of grief or bereavement, you reach out to them. That's the whole thing about outreach. It makes people feel that they matter and they're seen, and that what they're going through is a normal reaction to the loss of someone important and significant in their lives. So we have to be talking about this more and less, and have it less stigmatized than it has been in the past. So as caregivers, this should be something that is offered. And if not, we can ask our area agency on aging to have some services related to post caregiving.
I think what you said last week also was important, that if there are any healthcare workers listening or on, to just be more sensitive to the fact that if the person has passed away, to reach out to that caregiver. I know it might not be in the protocols of your agency to do so, but I think it's a very important, because the only way things can change is when we identify them and try to make that a part of our advocacy as healthcare workers.
You're so right, Lucy. I called our local caregiver resource center here. We have a great set of them in California, but they don't really want to talk to you unless you're actively caregiving. And I asked for some referrals to Life After Caregiving, and they were going to get back to me. That was on Tuesday. I haven't heard from them yet.
Darcy,
So
yeah. I think you want to say something.
I do.
was waiting for you.
I'm enjoying this. I really am. I am the caregiver coordinator for East Arkansas Area Agency on Aging here in Arkansas.
woohoo.
I to tune in and listen to this. So I just I know that Evelyn just said that many don't, but I do offer post services. Services do not end just because someone passed away, because that's a new phase in their life that they're entering that they need assistance with. And I try to be there. I just had 3 people, 2 lost their mother, 1 lost their husband. So I'm dealing with that as we speak right now. And it is really hard because I too was a caregiver for my father and my mother, and I know the stages you go through. Some days you want to talk, some days you don't want to talk. So I just let them guide me. But of course I reach out to each individual, because my clientele, they kind of know each other, and they'll call and go, did you hear about so-and-so? And I go, no. And so the first thing I do, I go Walmart and I either to Hallmark and I try to get a card to send out, or either the company will allow me to send them flowers. So they just need to know that we're here for them continuously. It don't stop just because we were there doing that part for the caregiving and that you needed our money. It don't stop. It continues.
Amazing. That is so heartwarming to hear that, I have to say. Thank you so much for that. And if there are any other healthcare workers on the line, it's something that we should all be practicing.
And you're a good person to learn from. You have to interview her for your book.
For the guide, we're going to get
The
back.
guide. Anybody else? Let's see. Myra, I still have your line open. Did you want to say something else, or is it just open from before?
No, but I did send you, Evelyn. I sent you, I found a webinar that you could read that from the, it's the Alzheimer's Foundation of America. They have a webinar. I haven't seen it. I was just doing research while I'm on this call. And I sent you the link for the webinar. And I also, by the way, I have heard of many organizations that do have support groups for caregivers who have lost their loved ones. So it may take a little bit of searching to find that group. I know in the groups that I belong with multiple organizations, some of the members continue to come just because we understood them, we knew them, we knew about their loved ones. They find comfort in sharing with us what they're going through, and also, especially when they've gone through the entire journey, they find it comforting to give back and share the knowledge that they've gained with someone. But it's important for me as an active caregiver to also support them, because I want them to be okay. And I'll tell you something, when you've done that journey, I feel that when I hear that their loved one passed away, to me, that caregiver earned their wings. You know, we hear about giving a Purple Heart. What you did was extremely very hard, but you did it and you did it beautifully. So I know it's painful to not have them, but I sincerely hope that you find comfort in everything that you did for your loved one. And now you need to take care of yourself and have no regrets. I know it's hard, but please try to take care of yourself.
You know, that's another idea for your guide, is getting it in the hands of all the support groups that aren't, you know, particularly focused on life after caregiving, but so that they understand what's going on with people in life after caregiving. It seems really important.
Well, Evelyn, thank you for that. You know, just to let the rest of you know, this has just popped up in this session about a guide, because Evelyn was kind enough to do research before and found that there's really very little. That's why I wanted Pam to be part of this. And hopefully we'll continue doing these kind of sessions, because I felt very strongly that there isn't enough. But we will, Evelyn, pursue it, and we'll see where we get with that one. And just to let you know, there's no guide just yet. We're going to make a proposal to possibly be able to do it.
And I just want to give one more little tip is, I know that we all may be in a specific part of the country or state, and maybe our local chapters may not have a grieving support group, but due to the impact of COVID, you can join a grieving support group out of California, out of Texas, out of Ohio. So do some research, because they are out there.
For sure. Thank you.
I'm going to leave it on Myra's note, because she said some good words, and the idea is please outreach and please find what could work for you. And in this, you know, Zoom world, there's lots of opportunities in other states and other provinces and across into Canada and anywhere, even in Australia, where we're connected to the Australian Grief and Bereavement Center, and they're very far away. So don't let your state or your country limit what you can reach out to and how you can connect with others. So that's it. I'm good. Thank you.
And before I pass it on to Evelyn, and please, for those of you who are not coping and you really feel depressed and can't seem to get out of bed, please pick up the phone today and call the doctor.
I can't thank you two enough. This was so interesting, a lot of new information. As a social worker for 50 and some years, it was really fascinating for me. Thank you so much, Pam and Lucy. I want the folks on the line to know that in several days, you'll be getting a post-session questionnaire. It will contain the resources that we've talked about, and maybe a few others if people want to send them to our customer service representative. If you know something in your area, I think a lot of support groups are run by volunteers, and that's why they're not on the internet. So that would be interesting if you have something you know about. I also would like to ask you to really take a minute to fill out that post-session questionnaire, because it helps us improve all the time. I'm still a little low on the tech industry, but I'm working on it. And we appreciate what you do so much, who you are. We're so happy you joined us today. And thank you so much for all of your input. And Lucy and Pam, what a beautiful job. I would also like to thank the Wellman Charitable Foundation for, supporting all of this great stuff that's going on here. And I would like to tell people we have a couple more presentations this month. We have tomorrow, Dementia and the Hidden Patient. No, that's this afternoon, sorry. Dementia and the Hidden Patient. And I think we all know who the hidden patient is. It's the caregiver. And then Thursday, the 26th, we have New Year's resolutions for caregivers' well-being with Dr. Jamie Heisman. And on the 31st, embracing tender memories in caregiving with Barry Jacobs. So those are going to be some good ones. We hope that you will join us. You are the lifeblood. You're the backbone of long-term care in this country and around the world. So with that, I am going to stop the recording, And I want to thank you all so much and hope to see you again.
Thanks, everybody.